Is this an appropriate response, splitting the Northern Beaches into two zones?
Good morning, Janika. It's always was going to be a tough decision about the epidemiology of what's going on here, about where cases are, how they're being managed. And we'd say that New South Wales is, they're trying to manage risk, but also it's on a bit of a knife edge. We still need to be really mindful that we don't know where this cluster started, and as has been talked about, we've been seeing positive cases in the sewerage for a number of weeks. So there's still some concern about where this actually came from and how it started. And the opportunity for this virus is that if people come together and mingle, especially if they've got respiratory symptoms, but even if they've just been, they're just at risk, we worry that there'll be more spread, and that Christmas time will could be a risk time for more spread across in New South Wales. So making distinctions between the Northern Beaches and the rest of Sydney, and then the rest of New South Wales is important, but certainly it's really clear that there's still risk up there, and there's still risk everywhere. Everyone has to be vigilant and ensure that if they've got any respiratory symptoms, it's not just I'll go get tested, it's I'll isolate and then I'll go get tested. So it's not something we put off until the next day. We try and get tested that day if you've got symptoms, and really try and make sure that we're doing the right thing by everyone else in our family and in our local community and for the state.
You mentioned sewage testing, and we also know that there have been a number of venues added, particularly in parts of Greater Sydney, to the New South Wales health list over the last few days. Is there a potential risk that there is an underlying infection in the community?
Look, that's always the risk with this. There's lots of potential for asymptomatic transmission that we understand. Our understanding of the virus has grown over the last in Australia over the last 9 to 12 months, and so that's why contact tracing. Lots of times we do test asymptomatic people. We test people without symptoms. There is definitely risk that this is further afield and we don't know about it yet. However, that's why the level of testing that's being done in New South Wales at the moment is so reassuring. Testing in lots of cases for a condition, an infection is often about the individual, but in this case, it's about the community. When we do 44,000 tests in a state to get back 8 positive results, we're essentially ring fencing and knowing that we have a good level of certainty that those are the 8 cases that were found, that were available to be found in those communities yesterday. But we need to keep testing until we get that number down to 0, and then until we stay at 0 for an extended period of time, so that there's not just absolute certainty about active cases, but about asymptomatic spread in the community.